Assalamualaikum. My name is Fatin Naziha binti Mak Gali. Today I will present the topic for monitoring of dialysis patient in MCB 1004. So the introduction of monitoring dialysis patient is the definition include continuous observation and assessment of dialysis patient during treatment. Purpose to ensure safety, effectiveness and adequacy of dialysis. So the importance of monitoring dialysis patient is to prevent complications, ensures dialysis adequacy, maintains patient safety, improve quality of life. So the standard state that dialysis treatment shall be monitored closely during each sessions lah. The main focus areas are first intradialytic complications. Observing for any complications that occur while dialysis is in progress. Example include hypotension, cramp, nausea or vomiting, itching, disequilibrium syndrome and bleeding. So the staff must be ready to respond appropriately if anything abnormal happen while the dialysis process lah. Second is vital signs during dialysis. The blood pressure must be checked regularly to detect hypotension or hypertension during sessions. Pulse to monitor heart rate, rhythm include tachycardia, bradycardia or arrhythmia. Temperature to detect fever that may suggest infection or other systemic response. The third is to assess the vascular lah. It continuous assessment for signs and symptoms of vascular access complications should be performed during each hemodialysis. It include the native fistula or we call the graft. Also, we should assess the catheter site lah. So for the native fistula or graft, we should assess the blood flow, venous pressure, thrombosis, mechanical failure, infection, skin erosion, aneurysm or pseudoaneurysm, arterial insufficiency or Still syndrome. So for the catheter, we must check the exit site inspection, signs of catheter thrombosis, symptoms and signs of catheter-related bloodstream infection. So in chapter 7.2, records of dialysis treatments. Every dialysis treatment must be documented. This means for each session, there should be a record showing what happened during the treatment. Record typically include duration, flow rate, which is blood flow or dialysis flow, UF volume, any interventions, example fluid bolus or medications, vital signs at specific intervals, complication, and how they were managed. What must be recorded? First of all, must be patient identification lah, include name, IC or registration number. Date and time of session, dialysis prescription, include blood flow, dialysis flow, duration, ultrafiltration target or dialyzer type. Pre-dialysis assessment include weight, blood pressure, pulse, temperature and vascular access condition. So the intra and post dialysis documentation, we divided into intra dialysis and post dialysis. So for intra dialysis, we should document the vital signs at intervals. Machine parameter include UF remove, heparin dose, conductivity, and also temperature. The complication and intervention taken also, should be documentation also. So for the post dialysis, we must document that the post weight and vital signs, vascular access condition, staff signature and verification. The record must be stored securely and retrievable for audits and medical legal purpose lah. So this is example the record of dialysis treatment lah. We have the month or year, date, type of dialyzer, number of used dialyzer, blood flow rate, dialysis flow rate, venous pressure, heparin, low dose or free heparin, blood pressure, pre-HD, intra-HD, also the post-HD lah, weight, dry weight, pre-HD and post-HD weight, IDWT, the target of UF, also the intradialysis complications. So what are these records importance? First is to monitoring effectiveness. They provide a clear record of dialysis effectiveness and help ensure patients receive the appropriate dialysis dose. Second, the patient care. They help guide and inform care, ensuring that individual patients' needs are met. The third is quality assurance. They are essential for monitoring and improving the quality of dialysis care provided. Fourth is safety. They contribute to patient safety by tracking critical information and intervention. So the long term for monitoring in chapter 7.3 is while this goes beyond just during dialysis, it complements intra-session monitoring to ensure overall quality and safety. The key component is the first is blood investigation. So we need to perform blood tests at regularly intervals, minimum every 3 months or more often if the doctor order lah or if the needed. Tests will include those relevant to hemodialysis, example electrolyte, Hb, calcium, phosphate, and albumin. So this is the example for laboratory investigation schedule for hemodialysis patients lah. For the full blood count test is minimum frequency. Iron study every 3 monthly. Urea pre and post dialysis is 6 monthly. Renal function and LFT liver function test every 3 monthly. Calcium or phosphate also 3 monthly. Fasting IPTH also 3 monthly. Fasting serum lipid is 6 monthly. For blood sugar, actually we investigate every yearly. If the patient got the diabetes, we should test every 3 monthly lah. For non-diabetes is 6 monthly. So for the HbA1c patient, if diabetes every 6 monthly, HBS also anti-HCV and HIV every yearly or 6 monthly. If patient that patient negative Hep C, also HIV negative. So the second is dialysis adequacy must be measured at least every 3 months. The method permit KT over V or urea reduction ratio that we call URR. The target is to deliver KT over V should be more than 1.2. The URR should be more than 65%. So what dialysis adequacy? The definition, it is the assessment of how effectively a dialysis treatment regimen is removing waste product and excess fluid from the blood, thereby improving patient health and quality of life. The purpose is to ensure that patients receive the appropriate amount of dialysis to prevent complication and maintain well-being while undergoing treatment for end-stage kidney disease. So what adequacy matters? It is to ensure toxin clearance and fluid balance. Also to reduce complications and hospitalization. Thereby is to improve survival and quality of life, and also acts as a quality indicator for dialysis centers. So how is it measured? Uh, it, uh, we will take the KT over V lah, a measure of urea clearance that indicates the efficiency of the dialysis treatment. The URR, urea reduction ratio, another common metric used to quantify the reduction in blood urea level during a dialysis session. So this is the example of the comparison of patient value versus the target standard lah, the URR. The patient value is 60, but the target is 65. Now for the KT over B, patient value 1.0, the target is 1.2. So the conclusion is we need to monitoring during the dialysis, ensure patient safety and early to detect any of complication. Otherwise, systemic documentation supports continuity of care and quality audits. Next, the long-term monitoring with blood test and adequacy KT over V over 1.2 or URR over 65% is to improve survival. Holistic monitoring address medical, nutritional and psychosocial aspects. Consistent monitoring provide and benchmark for quality, safety and accountability. So that's all from my presentation. Thank you.